There are a few simple home tests that you can do if you have quote-unquote adrenal fatigue or HPA axis dysregulation. Now, these are not the official medical tests. You'd have to do functional labs and that kind of thing, but these are two that can be very diagnostic. Now, my own experience as someone who went through severe medical burnout, heart palpitations 50 times a day, could only sleep 3 hours per night, major panic disorder and anxiety every single day, that took literally years to recover from, I would like to think, or my ego would like to think, I know a thing or two about what it feels like to go through the depths of hell and then what it takes to heal. Hey guys, I'm Dr. Alex Heyne, board licensed doctor of acupuncture and traditional Chinese medicine, and author of the health book Master the Day. So let's jump in. You know, when I think about the main patterns in quote-unquote adrenal fatigue, I like to think of them as the 3 stages. In stage 1, you typically are experiencing a lot more hyperarousal. You're seeing a hypervigilant nervous system where you're on edge, you're typically very anxious, you're overly revved up, but because the symptoms aren't going on for a long time yet, you're not chronically exhausted or chronically depressed. So in this stage, you often feel a lot of anxiety, palpitations, maybe you're getting tension headaches, and maybe you're starting to have sleeping problems, but it's not so severe that they're debilitating. In stage 2, first is alarm, then resistance, and then exhaustion. In the resistance stage, you start to see more, but you're getting more systemic symptoms. You might have more nights where you're having insomnia. You might notice that you're feeling a little bit of fatigue some days, or that you're maybe getting some actual panic attacks. At this stage, because it's going on longer, there may be more chronic symptoms showing up. Chronic GI problems, right? You can't digest anything. You're easily losing weight, or you're getting lots of stool changes because your GI is very weird. And then in stage 3, which is more the exhaustion stage, this is more where you see chronic fatigue syndrome, autoimmune disease, chronic exhaustion symptoms. In these stages, I look for different symptoms at each stage, but it's very difficult to assess that without other kinds of confirming signs and symptoms. In traditional Chinese medicine point of view, we say that adrenal fatigue are what's called heart and kidney not communicating. So what this pattern means is that the chronic adrenal stress is producing an overly revved up response. You're hypervigilant, you're overreacting, your body's not able to settle easily on its own, and even though you've listened to it, you're having a very hard time just going back to normal. Now, there are 2 sort of rudimentary exams that a practitioner may do to assess whether you are stressed or not. The first one is called the Pupilary response test, and the second one is called just the blood pressure test. When we talk about the Pupilary response test, and what the practitioner will typically do is they'll take a flashlight at an angle to your eye, and they'll flash it in and flash it out, and they'll observe the pupillary response. Does it dilate? Does it constrict? And effectively what they're looking for is if the pupil contracts and stays small, it potentially suggests normal adrenal function. But if it contracts and then it quickly dilates, opens again within a few seconds, it may indicate problems with the chronic stress response and or your adrenals. When it comes to the blood pressure test, people with adrenal dysfunction or this kind of pattern often have low blood pressure and may feel dizzy when they stand up. So what you do is you lie down and you rest for a few minutes and take your blood pressure. Then you stand up and you take it again immediately. So a healthy response is a slight increase in blood pressure. But if your blood pressure drops or you begin to feel lightheaded, it could suggest that you have this pattern of adrenal fatigue. So these tests, don't forget, are not the gold standard, the hallmark. If you go to a physician, while these are physical exams they can do, usually you need a serum cortisol test and other labs like assessing DHEA and that kind of thing. So usually they will rely on functional labs to assess cortisol levels and other hormones, and also even your nervous system. What else can we do to figure out the root cause of where this is coming from, and or if you even have this? I've actually put together a 1-hour live workshop, it's totally free, on the lost Chinese practices that are quietly helping people conquer anxiety and adrenal fatigue. It basically goes into my story of how I got incredibly sick from just chronically overworking and chronically stressing. And what I wish I knew was that there are 4 or 5 practices from traditional Chinese medicine that work. And the workshop goes through my story and those practices that can help you. It's the first link below this video. Get out a notepad and a pen and just go through and see how many similarities you see in there, in my story with yourself. And then we go into the practices and what you can actually do. So check that out. But on a symptomatic level, I would say there are 3 patterns of symptoms that are more indicative more than anything. And again, they aren't 1-to-1 100% correlated, but they are so commonly correlated I wouldn't even necessarily send my patients in for labs to confirm. So the first, that is the most diagnostic, is really changes in your heart rate and rhythm. People with this chronic stress response often have a high resting heart rate. They're prone to tachycardia. They will often notice a fast heart rate in the morning, or they feel anxious in the morning right when they wake up. But in general, tight chest, noticing changes in heart rhythm are the absolute number one sign and symptom. The second is changes in sleep. So sleep is basically one of the best indicators physiologically of what's going on with the parasympathetic and the sympathetic nervous systems. But how much you're spending in fight or flight and how much you're spending in that rest or digest. And so with sleep, really what we want to assess is, are you having a hard time falling asleep or staying asleep? Usually people with this pattern early on will start waking up around 3 a.m. They'll start getting fragmented sleep. Or if it's quite severe, they won't feel like they've slept at all. And they'll have very, very, very light sleep. And the third symptom is really mood changes that are very indicative of the other two symptoms. Most commonly, at the beginning stages, there's more hyperactivation, more anxiety, panic attacks, tight chest. The high heart rate for me is more indicative than sometimes even cortisol, because I have patients coming in with normal-ish cortisol, but their heart rate is very, very high. We treat the heart rate and then all the other symptoms end up going away. Now, if you're frustrated about how long these symptoms have been going on or how long they can take to heal, don't forget, if you've had these chronically, it can be 6 months to 2 years or longer without treatment for it to go away. And that means changing your whole life, downshifting, quitting the job, getting out of that relationship, stopping coffee. It can take a while. So don't give up hope. And again, if you're trying to figure out where it's coming from for you, download that free workshop. It's an hour long. Just the first link right below this video, punch in your email, and then it'll automatically send you a link to watch that workshop recording that I did live. We'll go into the 5 practices that are sort of like the lost practices from Chinese medicine that are quietly helping people conquer anxiety and adrenal fatigue and these kinds of symptoms. And I think it'll be really, really helpful for you. And then we'll go into not only my story, but what you can do. Don't forget, I work with a limited number of new patients every month in my clinic in Los Angeles or virtually via telemedicine. If you want to work with me, just go to dralexheyne.com/clinic, and all the contact info is right in the bio below this video. Phone, email, and booking link. And then I have another final video on anxiety and adrenal fatigue right up here.